Timing your Medicare enrollment can be confusing, but it's crucial that you do it right. There are different enrollment periods for different parts of Medicare, and if you're not careful, you may be subject to a late penalty. So today, let's break down the different enrollment periods for the different parts of Medicare. We're going to start with Original Medicare, which is Medicare Part A and Part B. Medicare Part A and Part B are Original Medicare. Basically, they're going to cover the majority of your needs. Part A is your hospital insurance, and Part B is your outpatient insurance. Original Medicare will cover specific services with doctors and hospitals who accept Medicare, and most do. And even though Original Medicare does provide truly comprehensive coverage, there are definitely gaps of Original Medicare, and that's why a lot of people look towards Medicare Supplement plans, also known as Medigap plans, Medicare Advantage, and Medicare Part D. We're going to talk about those in just a moment. Now, for Original Medicare, in all honesty, you'll probably be automatically enrolled. If you're receiving Social Security benefits, you're probably going to be automatically enrolled. However, if you need to do so manually, you have to do so during one of the following 3 times: your Individual Enrollment Period, a Special Enrollment Period if you qualify, or the General Enrollment Period. So if you're not automatically enrolled, your first course of action is to enroll during your Individual Open Enrollment Period. This is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. You need to contact Social Security to enroll in Original Medicare. You can do so by logging on to socialsecurity.gov, or you can contact them via one of the numbers on the screen. You may also be eligible to enroll in Original Medicare during a Special Enrollment Period if you've undergone certain qualifying life events. This is namely moving or losing coverage, but there's a full list on Medicare.gov. That's Medicare.gov. Now, if you've maintained creditable coverage through perhaps your employer, if you're working past 65, then you won't be subject to a late penalty. Just make sure that you enroll within 8 months of losing your coverage. Finally, there's the General Enrollment Period. This is every year from January 1st to March 31st, and then your coverage begins on July 1st. So you can absolutely enroll during this time. However, it behooves you to do so during your Individual Open Enrollment Period or a Special Enrollment Period if you qualify. That way you can make sure to avoid those late penalties. If you are subject to a late penalty, it gets tacked onto your monthly premium forever. Now let's talk about Medicare Part C or Medicare Advantage. So some people choose to forego Original Medicare in favor of a Medicare Advantage plan, which is Medicare Part C. So Medicare Part C will encapsulate all of the benefits of Original Medicare, plus a few extra. Very often these plans will involve some type of prescription drug coverage, which ordinarily you'd need Part D for. Very often they have dental, vision, hearing, and even gym memberships. So with Medicare Part C, you can enroll during your Individual Open Enrollment Period, a Special Enrollment Period if you qualify, or during the Annual Enrollment Period. Like Original Medicare, you have your Individual Open Enrollment Period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. Also, like Original Medicare, you may qualify for a Special Enrollment Period. However, with Medicare Advantage, the AEP, which is the Annual Enrollment Period, is different. The AEP runs from October 15th to December 7th. And to make matters more confusing, Medicare Advantage also has the Medicare Advantage Open Enrollment Period, which is the MAOEP, which is at a slightly different time than the Annual Enrollment Period. So this is from January 1st to March 31st, and it works a little bit differently. During this time, you can drop a plan or switch plans, but you can't join a plan if you're not already enrolled in a Medicare Advantage plan. Additionally, during this time, your coverage will begin the first of the month after you've made that switch. So if you enroll anytime in January, then your coverage becomes active February 1st. So this is a great option if you want to leave your Medicare Advantage plan or just switch to a different Part C plan if it's not working out for you. Now let's talk about Medicare Part D. Medicare Part D is an important one. Medicare Part D is your prescription drug coverage. Now, without prescription drug coverage, there are some name brand cholesterol medications that can cost as much as $1,700. This is, of course, an absolute extreme. This is not the case for most prescription drugs. I just want to stress the importance of how important prescription drug coverage is. Medicare Part D is also probably one of the most confusing parts of Medicare. So, like Medicare Advantage, it is offered by private carriers. However, it is federally regulated, so there are certain criteria that plans must adhere to. However, some plans will choose to offer better benefits than others, so some plans may be better for you than others. The enrollment periods for Medicare Part D are exactly the same as Medicare Part C. You have your individual open enrollment period, a special enrollment period if you qualify, and that annual enrollment period from October 15th to December 7th. Now, it is in your best interest to enroll in some type of prescription drug coverage, either Part C or Part D, during your individual open enrollment period or a special enrollment period if you qualify. If not, you may be subject to a late penalty, and again, this will get tacked onto your monthly premium forever. Finally, there are Medicare supplement plans. Medicare supplement plans are similar to Medicare Advantage plans in that they cover the gaps of original Medicare and limit your out-of-pocket costs. However, they really are very, very different, so make sure you don't confuse the two. Medicare supplement plans do not include prescription drug coverage, so you're definitely going to need Part D if you go this route. However, these plans are standardized. The benefits do not vary from carrier to carrier, and yes, they are offered by private carriers, so that makes comparison shopping much easier. Additionally, if you're enrolled in a Medicare supplement plan, if your doctor accepts Medicare, they accept your supplement plan regardless of who the carrier is, so you're going to have access to a much broader network than with something like Medicare Advantage. You can actually enroll in a Medicare supplement plan or Medigap plan year-round. There's no late penalties or anything like that to be aware of. However, it behooves you to do so during your initial enrollment period, or IEP. This is the 6 months after you've turned 65 and enrolled in Medicare Part B. So if you're deferring Medicare Part B for whatever reason, perhaps you're still working, then again, your IEP for Medicare supplement plans don't begin until after you've enrolled in Medicare Part B. Now, during this time, you won't be subject to medical underwriting, which means you'll have access to pretty much any plan you want. After your IEP, you may be subject to medical underwriting, which means you could be denied or charged more. So again, think ahead. You want to make sure that you have access to the full range of plans. Now, the final thing that we're going to go over is, of course, how to enroll. Now, we touched on this earlier in the video, but with original Medicare, that's Part A and Part B, you'll most likely be automatically enrolled. If you're not automatically enrolled, you need to contact Social Security either via website or phone. Now, for Medicare Advantage or Medicare Supplement Plan or Part D, you have a couple of different options. You can use Medicare.gov, that's Medicare.gov. You can contact the carrier directly and use an agent, or you can use a broker. All right, let's break it down, each of those options. So your first option, of course, is to contact the carrier directly and work with an agent. This is not something that we recommend for a couple of different reasons. So when you contact the carrier directly and work with an agent can really only discuss with you the plans that are offered by their company, that particular insurance carrier, which means a lot of legwork for you. You're going to have to contact multiple different carriers to really make sure you're doing your due diligence to ensure you get the right plan for your needs. Additionally, you're not going to receive any type of incentive or discount or rate reduction by contacting the carrier directly. Your other option is to work with a broker. A broker is a third-party liaison who works for you, not the insurance carrier. Now, many brokers don't charge an additional fee for their service, so if you want to work with a broker, they're basically going to be able to present you with all of the different options available. That way you can pick and choose. It's sort of like one-stop shopping. And like I said, many brokers don't choose to charge an additional fee for their services, so you're going to end up paying the exact same rate whether you contact the carrier directly and do all of the legwork yourself, or you work with a broker. And if you'd like our help, you can reach us at iHealthBrokers at 888-410-0344. There is, of course, no charge for our services. And another option for you to go it alone is, of course, to use Medicare.gov. That's Medicare.gov. So let's take a look at the website just so that you can get an idea of what it's like to navigate the plans on Medicare.gov. So here we are at Medicare.gov, that's Medicare.gov. So right now we're just going to preview health and drug plans. So ordinarily you would log in or create an account, but we're going to continue without logging in. So it's going to ask a few quick questions. It's showing 2022 plans. Of course, if you wanted to see 2021 plans, you just click here. So right here, it's going to ask you what you're interested in. Medicare Advantage, which is Medicare Part C, a drug plan, Part D, Part D, a drug plan plus a Medigap policy, which is a Medicare supplement plan, a Medicare supplement plan only, or it's going to say, I want to learn more about Medicare options before I see plans, which is going to give you information. So for right now, let's click Medicare Advantage. And it reminds you that Medicare Advantage bundles all health benefits plus extra services like we talked about earlier, like vision, hearing, dental, and more. I'm going to put in a zip code. And it's going to ask if you get any additional help from Medicaid, Supplemental Security Income, Medicare Savings Program, extra help from Social Security. You can also click I'm not sure or I don't get help from any of these programs. So we're going to click I don't get help from any of these programs. Now, if you take prescription drugs, then I highly recommend that you have your information ready because you're definitely going to want to compare the costs when comparing plans. So let's click yes. Okay, let's pick, we'll put in Lipitor, which is a pretty common cholesterol medication. It's going to offer you a generic. Always opt for the generic, you'll definitely save money. We'll add that to our drug list. And we're going to say we're done adding drugs. So this is important, it's going to ask about pharmacies. So here are some pharmacies located near the zip code that I provided. So let's click mail order, because you do want to compare those costs, and we'll just pick the top two pharmacies, CVS and Walgreens. And here are the plans available. So it's showing me currently 10 of 65 Medicare Advantage plans. Of course, if you were to scroll down to the bottom, then you would go to the next page to see further plans. Now, something that's very helpful, of course, is the filters. So we're going to look up here and we can filter by plan benefits, insurance carrier, drug coverage, star ratings, or if it's a special needs plan. So let's click on the plan benefits. Perhaps dental coverage is really important to you, so let's apply that. So now there's 58 plans available. So 7 of them did not provide dental coverage. Let's say that hearing is also very important to you. Let's apply that. Still have 58 available. Let's say your preferred physician, because we are talking about Medicare Advantage, only takes Aetna. Let's apply that. Now there are 6 plans available. And currently it's being sorted by lowest drug plus premium cost. You can, of course, sort it differently. You can do by just lowest monthly premium, lowest health plan deductible, or lowest yearly drug deductible. Sometimes they are different. So here are the 6 plans based on the filters that we put in. It gives you your monthly premium, your yearly drug and premium cost, that's an estimate, and any additional other costs. And then on the right-hand side of the screen, it'll highlight the plan benefits. Now let's say this is a plan that I'm very interested in. I'll click Add to Compare. And let's also add this one. We're just going to do the top 3 just so that you can see. So you'll see it's added it down here, and then we click Compare. And here it's going to give you an overview so that way you can compare the benefits more easily. So star rating coming soon for all of them. Health deductible, $0 for all of them. Drug plan deductible, these 2 have no deductible. This one has a $150 deductible. The maximum you pay for health services, that's different for all of these. Part B premium, then you can compare the benefits, the plan features. So these 2 offer transportation, this one does not. This plan offers chiropractic services and meals for a short duration. These 2 plans offer endodontics, And of course, you can click to view additional benefits if that's important to you as well. Then it's going to break down the costs for your benefits. So again, different. We have $0 to $50, $0 to $50. In network, $0 to $250. Out of network, 50% coinsurance. And that's because these two plans are HMOs and this one is a PPO. So as a reminder, PPOs will provide you for coverage in and out of network. It's just a different percentage based on in network or out of network. Whereas these two plans, because they're HMOs, that means that you wouldn't have coverage out of network. And then the extra benefits that were listed earlier, here's some information on the costs of those. All of these covered the prescription drug that we put in. And then here's the different copays. So it looks like you would definitely want to go with CVS or mail order for these plans. And that's just some basic information on those plans. Okay, now let's click drug plan. That's Part D. We'll put in the same zip code. I don't get help from any of these programs. And next. It's already saved the prescription drug that we put in last time, so we're just going to keep that. And we'll again select the same 3 pharmacies. And here we are. So there's 22 plans available in that zip code. And it's just sorting by lowest drug plus premium cost. That is the default. You can do lowest yearly drug deductible or lowest monthly premium without the drug cost, but the default lowest drug plus premium cost will give you the best idea of what your yearly costs would be. So the first plan is Silverscript, so your monthly premium is $770. And here's your estimated yearly drug and premium cost. And it does have that $480 deductible. So these are the plans available. Again, we could click Add to Compare. Oh, whoops. It saved these. We could click Add to Compare. Let's just do 2. And here you are. So it's comparing your monthly premium. This one's slightly more expensive, because this one, Walgreens, is out of network. This one, Walgreens, is in network. And that's really it. There's not much to compare with the prescription drug plans as much as something like Medicare Advantage, because the benefits of prescription drug plans are a little bit more straightforward. And the last thing that I want to look at are Medicare supplement plans, also known as Medigap plans. We're going to put in the same zip code. And this will be a little bit different. So it's going to ask you some basic questions. So we'll just put in 65, female, who doesn't use tobacco, because it's going to give you a range of prices based on the plan that you choose. Remember that with Medicare supplement plans, the benefits are standardized. So this range of prices here is really dependent upon the carrier that you choose. So it's not showing you the carriers in this moment. It's just showing you the plans that are available and the price range. Now, when I put in my information, it's going to update those prices based on that information. So that was a significant decrease, over $1,000. So it's showing you all 12 plans that are available: A, B, C, D, F, high deductible version of F, G, the high deductible version of G, K, L, M, and N. As a reminder, Plan C and Plan F are no longer being offered to new enrollees. And on the right side of the screen, it just highlights the benefits for you. So with Medicare supplement plans, what it's going to ask you to do basically is pick a plan, and then it's going to direct you towards the carriers. So here, let's say that you wanted to go with, we're going to do Plan G because that's the most comprehensive coverage available. We're going to see Plan G. So it's going to give you further information as far as the monthly costs, Part A deductible, Part B deductible, covered services and costs, then you'd click View Policies, And here are all the carriers that offer Plan G in this area. Then at this point, basically, you would have to contact each and every one of these carriers to find out exactly what your costs would be. So that's why we recommend working with a broker, because even if you've decided Plan G is the plan for you, then you'd have to contact 30 carriers to find out what's the best price. The final thing that we're going to talk about is late penalties. This is why timing your enrollment in Medicare is extremely important. You want to avoid these late penalties. Now, we've touched upon them earlier in the video, but now we're going to go a little bit further in depth. So let's start with Original Medicare. So this page on Medicare.gov details the late enrollment penalty for Part B. I'll put a link to this exact page in the description below so you don't have to go searching for it. Basically, for each 12-month period that you are without Part B that you could have had, you'll be charged 10% on top of your monthly premium. But here's something really important to understand. It's for a full 12-month period. So in this example that it details, it's discussing 27 months, but you're only going to be charged for 2 full 12-month periods, not that additional 3 months. So that means you would be charged 20%, 10% for each 12-month period that you're without Part B. However, what do you do if you want to defer Part B? Let's say you're still working. Well, we're going to discuss that right now. So if you're working past 65, this can be a great idea to go ahead and defer Medicare Part B. Because remember, Medicare Part B has a premium, and you don't want to be paying that premium on top of whatever you're paying for your employer-sponsored group health insurance. That's just not necessary. So make sure to follow the instructions on the back of the card and send it back. Because if you keep the card, you keep Medicare Part B, and you will be charged for it. So losing creditable coverage will trigger a special enrollment period. You're going to want to make sure that you enroll within 8 months. That way you avoid that late penalty. If you do incur a late penalty, you'll be charged 10% for each 12-month period that you are without coverage. And again, this gets tacked onto your monthly premium forever. You're also going to want to avoid the prescription drug penalty. Basically, you can't go for a period of more than 63 days without creditable prescription drug coverage, or you may be subject to a late penalty. In all honesty, this penalty can be rather minimal, so there are times where it may make sense to incur that penalty to avoid paying premiums unnecessarily. We talk about that in other videos. The late penalty is calculated as 1% times the amount of months without coverage times the national base beneficiary premium. Now currently the national base beneficiary premium is $33.06. However, it does go up on a yearly basis. So right now, if you only go for a couple of months without coverage, your penalty could be less than $1. But the longer you wait, the higher your penalty. If you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. Like I said, one of the ways to enroll in Medicare is to use a broker, and there is no charge for our services. And as always, please make sure to like this video and subscribe. That way you can stay up to date on all things Medicare. Thanks so much. Have a great day. Bye-bye.